Now, from the outside, this building in the Chinatown section of Houston near Beltway 8 and Bel Air looks like many others, but inside is where one of 4 Hope clinics is doing the business of catering to the needs of the community in ways many are discovering it for the first time. It is the Asian American Health Coalition that has morphed into the Hope Clinic. I think that's an appropriate name.
Correct.
That's it. Dr. Andrea Karakostis is the CEO of the Hope Clinic, joins us this morning. The more I find out about this clinic, the more I'm amazed about the work that gets done there. Talk about how did this start as a coalition of sorts, and now it's morphed into this clinic that really is doing a lot of things.
That's correct. It started as a desire of 4 women to educate the community, the Asian American community, in language, Vietnamese, Chinese, about diabetes and cancer exposures, breast and cervical cancer, particularly because the community had no access to health care. And of course, you educate people and tell them about health care, and now they want access to services. So they realized very fast that if you educate people, then you have to provide them also access to care. And they opened Hope Clinic in 2002 as half a day a month clinic, all volunteer doctors from the Chinese Baptist Church. And in 2005, we had Katrina. Katrina brought 15,000 Vietnamese evacuees from Louisiana to Houston. And Hope Clinic stepped up to provide, they were housed at the Hong Kong Mall on Bel Air. And Hope Clinic stepped up as one of the volunteer agencies with volunteer doctors to serve this community. And all of a sudden, the numbers were there. All of a sudden, there was this disparity showing that, we're all these Asians with healthcare needs all of a sudden, because statistically, there's only whites, blacks, and other. So Asians were always lumped in other, and no one knew what other is. And so all of a sudden, there was the specifics of who those other were.
Is there a certain kind of malady or problem that is usually found in the Asian community that's not found in other places?
I think that we all kind of get sick the same way. We'll get COVID, we'll get the flu, but certainly some communities have additional disease burdens on certain diseases, and certainly in the Asian community, we've seen a lot of hepatitis B. And so the Hope Clinic has really stepped up in treating some of that hepatitis B in all its forms. We do the screening, management, treatment, and follow-up of the patients. But also we specialize, and we have created that in refugee communities. And refugees come with a large number of healthcare issues, in particular the fact that they've never accessed healthcare in many ways. So you have to immunize them. They're behind in their immunizations for the children and the adults, tuberculosis and all kinds of infectious diseases. So it's a great place to train.
I thought that was very, when we talked earlier, that is true, that there are a lot of the people who you see are seeing a doctor for the first time.
That is correct.
That has to, now that's also as you have broadened your approach. Initially, and when I looked at the website and I saw Asian, as you said, it was lumped into one big thing, but there's a lot of different communities within the Asian community that you're dealing with. Talk about some of that.
So we of course, some of the main languages are, Vietnamese and Chinese, but even within the Chinese community, you have the Taiwanese, you have the Hong Kongese, you have the different ethnicities within China's a huge country, and they've come during different periods to this city, and so we have seen big waves of new Chinese comers right before COVID, and then kind of stopped. But we also see Burmese, and the Burmese are also very diverse because they are Karenni, they are Rohingya, and many of them have never been recognized as Burmese themselves, so they don't have a nationality. So when they become U.S. citizens, it's a big emotional deal for them because they've never belonged to a country. And I think I didn't realize how important a role the United States plays in giving a lot of countries that are ethnic groups that have not been recognized. They've been persecuted all over the centuries by different countries, and they come here and they find solace and refuge, and I think that's amazing.
And now you provide opportunities for them to find health as well. One of the things that you told me earlier was something that I don't think ever happens, and that is, number one, you have a chef at your clinic, which also helps people with their food intake, and your doctors sometimes will say they'll walk with the patients. So that is very unusual, is it not?
That is, it sprung from the idea that, first of all, we have a very diverse community, so it's very hard to lump everybody in and say, this is your plate of food, because people don't even use a plate, they use a bowl. Or their carbs are not just, you know, potatoes and rice or noodles. They have a diverse composition. So we came up with the idea of bringing a chef on board and helping people, first of all, feel proud of their unique cuisines and preserving, not trying to, you know, push them into acculturation, keep them with their healthy foods and give them pride. And also by modeling and teaching them how to cook, because it's very easy to give someone a box of food and it has, you know, 3 cans of things you can eat and the stems of broccoli, and you don't know what to do with it.
Right.
So I think that giving people a variety of things they can eat, and especially reaching the young. So we do a lot of teaching to schools in Aldine and Alief, where our chef provides free classes to middle schoolers. We give them the box of food to take to their families, and then they get to cook online with their moms and dads, because food is so much more than what you put in your mouth, right? It's relationships,
Absolutely.
It's the smells of your grandma, it's creating memories, it is those bonds. And in this era where we're so solitary, we've seen that through COVID. People have been isolated, and these communities come and they lose their roots, they lose their grandma, they lose their grandpa, and I think bringing that through food is one of the things we would like to do.
How can viewers help Hope Clinic move forward? What can they do to help you?
Well, we depend on our patients, and I can tell you we provide fabulous care. We have over 40 doctors in our staff, and we provide incredible prenatal care, for example. Come and be our patients. If you already have a doctor and you want to support us financially, you can log onto your website as well. And we're opening a brand new clinic on Bel Air between Highway 6 and Eldridge, 70,000 square foot facility, state of the art. And you know, not because you are getting care in a nonprofit should you think that it's second class care. It is first class care and dignified care.
Well, we're going to make sure that everyone has that information so you can go on, as we do on this Christmas Day, to do something that's going to be wonderful, and that's help this organization, which is already doing wonderful things. Dr. Karras-Kotis, thank you so much for being here. Good luck to you as you continue in 2023.
Thank you. Thank you so much.